Hello, how are you?
Fine.
My name is Mamoon. What's your name?
My name is Tamim.
Tamayizdeen. You have pain in the right shoulder, right?
Yes.
Okay, I'll be examining your right shoulder if you don't mind. If you have any pain or any problem, let me know, okay? Now first the patient was sitting. I prefer him standing. Can you stand up? Okay, just stay here, stay where you are, okay? So looking at him standing, he has symmetrical shoulders, no obvious swelling or deformity or anything extra, like bandages or slings. He's not in pain, he's comfortable. And can I see your back? Yes. Looking at him at the back, again, there is no obvious swelling or deformity, symmetrical. The bulk of the supraspinatus is the same, infraspinatus again the same. Position of the scapula looks to be equal. Deltoid contour looks to be also symmetrical. And now again at the side, looking at the side, and sometimes I ask them to sit. Can you sit? So that I could look at the front a little from above, so that if there is any swelling, I could also notice it much clearer. So that's, before ending look now, we also have to look at the side, the armpit, make sure there is no obvious swelling or deformity or scarring. This is an area often missed in the look actually, and in the feel, in the elbow, in the shoulder examination. Okay. Now we do feel. I will put my hand on your shoulder. If you have any pain, let me know, okay? First of all, generalized tenderness. Any pain here?
No.
No pain? Here?
No.
No? At the back?
No.
No pain there? Here?
Yeah.
Here?
Yes.
Okay, so it seems there's some pain, tenderness in this area. Now I go a little more specific. Sternoclavicular joint. You may start from medial to lateral or lateral to medial. Any pain there?
No pain.
Along the clavicle and to the acromion? Here?
Yes.
Okay, there's a little pain beyond the acromioclavicular joint, a little there posterior. This here?
Yes.
Yes, okay. Any pain here?
No.
No pain on the deltoid. And this is the anterior part, the bicipital tendon. Any pain there?
No.
So there is no tenderness in the bicipital tendon. And can I see the back a little? Again, supraspinatus. I feel for bulk and tenderness. No pain there?
No.
No. The spine of the scapula, the infraspinatus, and along the borders of the scapula. It looks okay like to me here. And again, before finishing tenderness, I need to feel for tenderness in the armpit as well. Any pain there?
No pain.
No? No pain?
No.
Okay, good. That's good. Now temperature, I just want to feel the temperature. You feel proximal and compare that to distal, and you compare the same area on both sides. Same area again on both sides. Make sure you compare again both areas. Can I see the back? Again, both areas on both sides to make sure they're equal. Okay, good. Come back. Now I want you to move the shoulder. Just mimic what I do. I start with the Apley's test. This is just a general screening test. Can you put your hands behind your shoulder? This shows abduction and external rotation. Put it back. And at the back of your shoulder, can you tilt around? Let me see your back. Can you bring this as high as you can? As high as you can. Okay, and the other one? Okay, both are equal. This is internal rotation and abduction. Okay, okay. Come forwards again. Now mimic what I do. Both arms up, all the way up to top. That's abduction. Okay, and this way, that's adduction with slight flexion. All right, and I want you to put the elbows on the trunk, like that, straight hands, and now put these in. This is internal rotation. Put these out. This is external rotation. All motions here seem to be equal on both sides and symmetrical. Now, we also look for a painful arc. how much of the abduction arc is painful. If the pain on abduction is at an initiation, like start this, there is pain where? Okay, it's here. Okay, so this is a supraspinatus tendinitis pain. Can you still do this more? No pain? No pain now. All the way? No pain. If he has pain in the middle, this is pain caused by rotator cuff impingement syndrome. And if the pain is right at the end, it's the acromioclavicular osteoarthritis pain. Okay? Now, because he has pain, again on initiation, I try this again. There is pain? Okay. Push. More pain, huh? Okay. So this confirms it's supraspinatus tendinitis. We can also do rotation and abduction. We did rotation and adduction. Now we ask him to abduct. Do this. Now, tilt this way. This is abduction and external rotation. And go back again to the middle and down. This is internal rotation with abduction. Okay, so this seems to be again good range of motion. Now we go for special tests. I'll start with the impingement. You can use a Hawkins or Mears or any other test for impingement. Basically, to make it easy, what we need to do is you need to ask the patient to flex forwards with slight abduction all the way and then internally rotate. So put your thumb like this. Okay, now do what I do. Straight, forward, up, all the way up. And now put the thumb down. Is there any pain?
No.
No pain. So this is negative impingement. Or you can start with, put the thumb up. You can start with internal rotation. And now abduction and flexion. Any pain? No pain. Those who have a rotator cuff, it will impinge in this position and cause pain. Okay? So that's impingement. Now the other test I do is apprehension test. I look at the patient's shoulder and I ask him to do this. And then from behind, I try to push the head of humerus forwards at the same time as I extend the abducted shoulder. So as if I'm trying to dislocate the shoulder anteriorly. Now those patients who do not have the experience of dislocation, like him, will not be apprehensive. But if they know this, we might dislocate the shoulder because they have a previous history of dislocation, they will be very apprehensive and they will not allow you to do this. That's the apprehension test. Now I go for special tests for muscles. If there is a bicipital tendinitis, we already said you might get tenderness on the bicipital groove. And when they flex, you ask them to flex the elbow and resist it, pull up. If that causes pain in the bicipital tendon, this is bicipital tendinitis again. And I need to test the deltoid. The deltoid is abduction, so they either do the abduction this way or ask them to keep your hand like this. Just keep it like that, straight, don't push. Keep it up. So this is the arm, the drop arm test. It doesn't drop, so the deltoid is working. If the deltoid is not working, the minute I do this, the minute I leave it, it will drop down. That's for deltoid. Of course, you also need to test for axillary nerve sensation on the lateral side of the shoulder. For the supraspinatus, we already did that with the supraspinatus tendinitis, and we know we have pain. He has pain like this. We resist initiation of abduction. Now we are left with the serratus anterior. Can you turn around? Put your hands on the wall. Yes, come forwards a little more. Okay, push the wall. Make sure it doesn't fall. Okay, he pushes the wall. We check the scapulae. Do they wink or not? And this is for the long thoracic nerve injury or serratus anterior muscle function. So it's negative in his case. Okay? And of course, before finishing, you thank the patient. Thank you very much. You can put your clothes on.